welcome everyone to All-Star Family Chiropractic in St. Joseph, Michigan. I'm Dr. Sandy Martin, and we're going to talk about your return on investment and comparing the cost, the risk, the time recovery for different modalities, for different methods, for different, actually full philosophies out there, because we live in a sick care system. If health insurance was really health insurance, it would pay for your grocery bill and gym membership. So what we have are ways to deal with sick care, recovery care. And the most common in what we're going to be comparing typically is low back pain, specifically chronic low back pain. And there's many reasons for chronic low back pain. So in some of the things that I go over, there's always going to be one story that's a little bit different or that happened different, but we're going to be talking about the majority of the situation out there in the statistics. There's also going to be where I kind of might smack down or talk bad about a different philosophy out there. I'm not saying I'm right. In the end, all the patients need to know all their options and being able to choose what's best for them without judgment. And that's what it comes from our office, is that this is the way I would do it based on what I know. And if you knew what I knew, you would do what I do in order to be healthy, wealthy, and wise, right? We all want to live our best lives. So right now, I'm asking you to slow down, to take a moment, to open your mind and to open your heart, to be present. Because the time that you're here right now and connecting is by no accident. The time that we have together needs to be useful, and I can't do that if I'm just shouting at you and telling you you're right or wrong. We need to slow things down and understand so that we can make the best decisions for our lives, which then affects the people around us. And that's what life is about, right? Helping other people, the ones we love. So in comparing care, I might be just standing in the way of this, but we're going to talk about the return on your investment, kind of, and the comparing of care. And we're going to be talking for low back pain specifically, whether someone had surgery, whether someone went through physical therapy, whether someone chose to do pain management and medication, or if someone chose to do chiropractic care. Now there's other things out there, massage, acupuncture, but these are the four main types that are most utilized by the general public. Low back pain is mostly caused, chronic low back pain specifically, mostly caused from smoking, obesity, having a sedentary occupation, a desk job where you're not up and moving, and having limited resources. So the people in poverty are most likely to have low back pain. It is an over $50 billion a year industry. And 80% of adults will experience low back pain at some point in their life. That's a lot of people. Now, we're going to break this down so I don't go off into tangent. So let's talk about surgery. So in the case we're talking about surgery here, this is chronic low back pain. So someone has lived X amount of time, usually older, usually people over 60 years old have this type of surgery. So there's different types, 3 different main types of surgeries that happen for low back pain. There's many different types and methods, but mainly 3 most common ones. It is typically caused from arthritis, degeneration, or disc degeneration. I'm trying to say this or set us up so that I'm saying it's not due to just some injury. Okay, because we live in the best medical world. The U.S. has the best medical professionals when it comes to the ER, and when they know that what the cause is, they're able to treat it. But what we're stuck in is a healthcare system that's broken. It has amazing people in it that want to do amazing things and help people, but that's typically run by insurance and money games and things that aren't actually helping the people. So in low back pain surgery, someone might have a laminectomy, a discectomy, or a fusion. A laminectomy is where they actually cut out part of the bone to allow the nerves more space so that they don't have pressure on them causing that pain. A discectomy is where they go in and they shave part of the disc that might be protruding, like a herniated disc, onto the spinal canal. And then there's a fusion where typically the low back tends to be unstable or it needs to create more space vertically, so they actually fuse the bones together to make them more stable. But of course, if that is happening, you lose mobility, which in my opinion, life happens in the motion of our joints. If something's not moving correctly, we're starting to die. So if someone were to have a laminectomy or discectomy, which are more common, the typical recovery time is anywhere between 2 and 6 weeks, most commonly 4 weeks. But if they live in a high-stress job, they might take longer. If someone is to have a fusion, it might take up to a year before they return to work. Functional improvements. So what happens, what are we expecting to happen if someone were to have a laminectomy or discectomy on their low back? Well, the odds are 3 in 4 people will have improvements. About 33% will stay the same or have no improvements, and about 1 to 5% of people that undergo this surgery will have worsening symptoms. There's also a lot of risks that come with surgery. So in the box that we fill out, so I have a chart here where I filled out all of these for every single thing. This one has the most amount of risks. When you undergo any type of surgery, there's risk of infection and blood clot and scarring. Specifically, the low back surgery with a laminectomy or discectomy, there could be damage to the nerves because they're working so close to the nervous system. You could have recurring symptoms. Just like I said, 33% continue to have symptoms within a few years of having the surgery. And one case said a reaction to the anesthesia, or even possibly stroke, but I think it's a specific type of stroke. The surgery itself is not. And 2 to 17%, so the studies on this were unclear, but 2 to 17% of those surgeries might get a dural tear. And the dura is the matter that, it's like a skin-tight tissue holding in your cerebral spinal fluid. So because they're working so close to the nerves, if they nick that, it's definitely not good. So it could be as low as 2% though, that might happen in the surgery. What does this cost? Well, it's cheaper to have a laminectomy or discectomy, including hospital stay. It runs you between $15,000 and $45,000. Remember this number because I'm actually going to go back when we get into chiropractic care. I'm going to use the number 30,000 based on that number I just shared with you. Okay? If you had a fusion, 2 or more vertebrae fused together, you're looking at anywhere between $80,000 and $150,000, including hospital stay and everything that comes with that. So surgery definitely has the most risk and is the most expensive. Then there's pain management using medications, things like that. Now that's going to be depending on the person and the time frame. You know, we're also talking about injections here. The functional improvements, it's going to be less pain typically. Most people experience at least less pain for at least 3 days. That's what I see clinically. Some people experience less pain for up to 3 years after injections or medications or continuing medications, which when someone has less pain, they're able to function better. They're able to move better, have more mobility. But is it really solving the problem? The problem is actually just continuing to get worse. It's a Band-Aid, which, again, no judgment if that's something that you've chosen to do. But this is where we've created an opioid crisis, and this is going to be one of our spinal workshops in the future. There's a pandemic or epidemic on opioids. There's way too many people on these painkillers that are creating a life not worth living, in my opinion. Everyone has that choice. I mean, no judgment. I mean, everyone has that choice of what they feel life is worth to them. But in what I would want for you, my hope and my prayer is to live your best life, being able to do with the least amount of pain, but be able to also function at the best of your ability and be able to help the people around you. What happens, complications and risks with pain management and medication? Your disability gets worse because it's not solving the problem. You might have addiction. Pain is altered due to other drugs sometimes, and because of the drugs that people get on, there might be hallucinations as well. The cost of pain management, well, that depends on how long you're on it. My hope is if you do have to go on some type of opioid, narco, things like that, that you're not on it for longer than a week or 2. But there are some people that have had to go much longer. In a study for 6 months, it's going to can cost up to $15,000. But it's a high burden of disability, which means it's also going to cost, like if we break that down a little bit more, It could be anywhere between $50 to $100 a month, depending on the pain medication you're on or what your insurance covers as well. Then there's physical therapy. The recovery time for physical therapy is anywhere between 4 and 8 weeks, typical 6 to 8 weeks. So about 2 months worth of care to see if physical therapy is going to take care of like your chronic low back pain, which I am actually a fan of physical therapy, and we're going to get into that in a second. But what the difference is between that and chiropractic care, because these are very similar therapies. So the functional improvements with physical therapy is you're going to see increased range of motion, strength, mobility, you're going to be able to control pain, which all lead to an increased quality of life. These are all the same things that we see with chiropractic care as well. The complications and risk of physical therapy, you might be sore for like 1 to 3 days. Depends on how hard the therapist pushes you. You might get prolonged discomfort, but what we're finding now, so like people with low back pain, it hurts to walk through the pain, because the exercise is more beneficial than the risk of you being injured or prolonging the pain, and it's typically not making the situation worse. So keep moving through the pain is my best recommendation. What does it cost for physical therapy? This is also very comparative to chiropractic care. You can find it anywhere between $50 to $350 per session. The national average was $150 per session with a physical therapist. But you multiply that twice a week for 8 weeks, which is a very typical care plan for someone under physical therapy, and you're looking at approximately $2,400 in 2 months. Now I'm going to go into chiropractic care. Chiropractic care recovery time. One study showed that in someone's first visit of being adjusted, we typically see 40 to 80% improvement in pain. But because what we're dealing with are subluxations, a misaligned vertebrae putting pressure on a nerve, those bones want to go right back out within 24 to 48 hours. So people get a reduction of pain right away, but it tends to come back. So we have to train your body to hold the new position of the bone so that it's more aware to be in spinal alignment. So it takes approximately 1 to 4 weeks of regular chiropractic care in order to see maintainable improvement. Same as physical therapy, right? Up to 4 weeks, 6 weeks, 8 weeks. The functional improvements on top of what physical therapy had, also increase in spinal motion, increase in physical function, and a decrease in pain. All those are still can be found with physical therapy too. The risks of chiropractic care, if there is a herniated disc, it can get worse. This is why we do extremely thorough checkups. If there's pressure on a nerve, an adjustment could make it worse. There's a certain type of stroke associated with chiropractic adjustment. Now, let me preface that. People are fearful with the neck adjustment because they've heard, oh, it can cause stroke. Now, this first fear came out way back when, like in the 1970s, maybe even the 60s, and it listed all the people that had a neck manipulation and how many of those people had a stroke. And of those people that had a stroke, they listed who did it. And only 1 or 2 of them were actually chiropractors. The other people that were performing neck manipulations without a license were barbers. Yeah, some physical therapists were on there, massage therapist. Only one of them was a chiropractor. So a physical therapist is allowed to adjust, and they're probably good at what they do. But the difference between a physical therapist adjusting someone's vertebrae versus a chiropractor adjusting someone's vertebrae is going to be the physical therapist is doing it to treat a symptom, whereas a chiropractor is doing it to address the cause, the whole, the body. Because if someone comes in with low back pain, you can bet I'm going to be adjusting their neck too. Because every single nerve has to go up the entire spine in order to connect to the brain. So if your neck has a kink in it, that means the communication to and from the brain can be off, which then can send signals. If your neck had a kink in it, and then what we have is called the righting reflex, so our eyes want to go level to the horizon, it brings up a shoulder, it brings up a hip. And now we're walking on our legs unevenly, creating hip imbalances and low back imbalances, and then we develop low back pain before neck pain. Or we've learned to live with neck pain because of all the computers and the way we sit and looking down at our tablets and phones or watching the TV with our feet up. We just learn to live with it and think it's normal. It's not normal, it's common. So the odds of a stroke happening in a chiropractic office is like 1 in 500,000 adjustments. It's safer than getting in your car. I'm going to come back to that about safety. There's also a risk of chiropractors cracking ribs. I mean, we push on the thoracic. It's usually the straw that broke the camel's back, you know. Looking up for osteoporosis, another reason why we do thorough exams, making sure osteoporosis is where the density of the bone has diminished, therefore it's not as strong. So pushing into it, we have to really watch out, especially in the elderly ladies. I hate using that word, elderly. You're only as old as you feel. So the cost of chiropractic care, it can be anywhere between $30 to $300 a visit, depending on what region you are in. So for example, our 3-month care plan, though, runs approximately, without any discounts or insurance, $1,800. But if you were to do what we consider like our lifetime wellness care, 1 time a week being adjusted, that's only $1,600 per year. Now, this is where I want to break it down. Remember when I was talking about surgery, and the cost of surgery is typically between $15,000 and $45,000. If we take in between that and go with $30,000 as more of an average, and we divide that by 52 weeks, that's going to give us 1,000 chiropractic adjustments. So I took $30,000 in adjustments divided by $30, because that's our typical what we collect here. That gives us 1,000 adjustments. Divide that 1,000 adjustments by 52 weeks in a year, that gives us 19 years. So spending $30,000 over your lifetime, or in just 19 years, what kind of outcomes do we get versus spending $30,000 on a 1-month bill and going through surgery and the recovery time? This is our return on investment. What is your life worth in investing in order to make sure it's the best? Because those under regular chiropractic care tend to have more vibrancy. They tend to not go into back surgery or have less arthritis as well, because scientists have shown a spine kept in proper alignment and maintained that way on a regular basis can live in excess of 125 years without any signs of arthritis or degeneration, which is one of the most common causes of chronic low back pain. That is why at the very beginning I wanted to preface this that we're not talking about low back injury. That can still happen. So even if you chose to invest in yourself and chiropractic care, you're going to live a more longer, healthier life, I believe. However, accidents can happen, injuries can happen, so I can't guarantee that. Everything in life is a practice. We just have to choose what we're worth in order to invest in that. I wanted to circle back onto safety. Talking about a chiropractic adjustment, because a lot of people, they tend to get scared. They hear the cracking, they think it's bones cracking, or, I mean, there's a lot that can go into it. I just don't want my neck touched. It's very sensitive. I get that. I get that. We use a lot of different gentle techniques, and we work with people who have osteoporosis or a higher risk of stroke to use more gentle techniques to allow the bone to move as well, and them to get wonderful outcomes and less pain and more functionality out of life. So when it comes to risk, everyone, like the surgeon, the physical therapist, the pain management doctor, the chiropractor, we all pay malpractice insurance. Let me put you on the spot. How much do you think a surgeon malpractice might be? It's going to be a lot. Go ahead, type in your numbers if you want online. So a general surgeon in the state of Michigan, on average, will pay $67,000 a year in malpractice. Higher than that is OBGYNs and the major surgeons, cardiac surgeon, that type of thing. They'll pay $90,000 a year. Yeah. Hearing those numbers, what do you think a chiropractor pays in malpractice adjustment insurance? Some guesses are half, less. I pay around $2,000 a year because they know what I do is safe. The odds of someone actually getting a serious injury during an adjustment is extremely low, way low. So when we talk about safety and we talk about our life and our importance and how we're going to invest in it, wouldn't you want to start with the most conservative thing out there? which would be chiropractic care and physical therapy. Now, the difference between, like I said, not all physical therapists are going to see the need for an adjustment or the correction of a vertebral subluxation. And therefore, what happens if they just strengthen a muscle, someone might feel better. But if they don't get the joint, like these are two bones stacked on top of each other, and if they're misaligned, and you continue to work a joint that's in malposition, strengthening the muscles around it, the pain might go away, but the problem's still there. This is why chiropractic care and physical therapy work so well together. Because when someone is aligned, then the muscles are able to work better and then slow the problem down from coming again. In our office, we are then able to identify where people are making bad habits. So if once you get under regular chiropractic care, we can see if I'm adjusting the same thing over and over again. I'm able to say, okay, you're in this motion. Maybe it's the way you sleep. Maybe it's the way you sit in your chair. Then I'm able to say, hey, we need to be aware of this, and this is how I want you to change it. These are the exercises to make you stronger. Now, where a physical therapist becomes more helpful is that I'm not going to take the time to make the exercises specific to my patients. I'm going to throw out little things out there, say like, all right, we need to focus on your core. I'm recommending you just go on YouTube, find this 7-minute video on how to do an ab workout. Do it 3 times a week. A physical therapist is going to slow down with you, help you work more specific to your goals. So, or an athletic trainer for that matter too. So if you're not going for specific problems but just want to invest in your health, getting an athletic trainer would be a really great idea along with chiropractic care. So, I'm going to go on to this. We have a lot of things to consider in life. There's a lot of choices. Some of them are life-changing choices. Some of them are just subtle things that lead to the next choice, that lead to the next bad decision. Now, in the leading causes of death, something like heart disease, cancer, lower-level lung infections, diabetes is like 6th or 7th on the list. Accidents is up there right before diabetes, strokes on there. There's a lot of things we can die from. But how many of those top 5 are actually preventable? Because none of those are the leading cause of death. What the leading cause of death is poor decisions. We have to decide what is best for us. So even like working with my 5-year-old, she's addicted to sugar. It's everywhere in our society. It is 6 times more addictive than cocaine and lights up the same areas of the brain. Yet it is socially acceptable. We have to be able to take temptations like sugars, fast foods, out of the equation. So I really want to slow down and remember and anchor onto that heart and the mind and the openness of everything about what life is really worth, to make the most out of each day. So here's the scenario. A bank credits your account each morning with $86,400. It carries over no balance to tomorrow. Every evening, you lose the balance you failed to use during the day. So what would you do? You would draw out every cent, right? You would use it every day. Give it away. Who cares? You're not going to have it into tomorrow. So each of us have such a bank. Its name is time. Every morning, it credits you with 86,400 seconds. Every night, it writes off what you have failed to invest. If you fail to use the day's deposits, the loss is yours. There's no going back. Invest it as to improve, to get the most from your health, your happiness, and your success. The clock is running. Make the most of life today. So if you want to realize the value of 1 year, ask a student who failed a grade. You want to realize the value of 1 month? Ask a mother who gave birth to a premature baby. To realize the value of 1 week, ask the editor of a weekly newspaper. To realize the value of 1 hour, ask the lovers who are waiting to meet. To realize the value of 1 minute, ask a person who missed the train. To realize the value of 1 second, ask a person who just avoided an accident. Treasure every moment. Yesterday is history, and tomorrow's a mystery, and today's a gift. That's why it's called the present. We're all given this gift every day of time. We never know how much we have or when it isn't going to get used. And sometimes our plans go awry, but nothing happens by accident. We're here on purpose, in this room together, online together, for you to take one thing away from this, to apply it to your life, because learning something and not applying it leads to depression. Information without application leads to depression. We know better, yet we'll beat ourselves up or feel guilty for not doing it. So this is my call to action. What one action are you going to choose to do to make your life a little bit better today? Because you need to take care of you. You don't take care of the kids first. You don't take care of everyone else first. You need to take care of you first so that you are then able to take care of others. And if you have kids and you're like, oh, I don't agree with that, as my mother-in-law doesn't, slow it down. How would you want your kids to take care of themselves when they're your age? We need to be the role model for how we want our kids to be as adults. Take care of yourself and you're worth the investment, because it then shows the future, our kids, how to live their best life as well. And all of us are deserving of that. So thank you for your time. Look us up on Facebook if you're close. This is March 1st, 2022. We have Patient Appreciation Week coming up soon. So if you're watching this as it's being recorded, feel free to jump on our website or our Facebook page. It'll lead you to the right direction. Actually, All Star Family Chiropractic, just start scheduling, we'll call you. So it's allstarfamilychiropractic.com. Thanks for visiting us tonight, guys. Have a great night.